Good morning. My name is Leigh Ankrum, and I'm going to be talking a little bit about scar tissue and adhesions, and a little bit about the difference between them. What's the difference between scar tissue and adhesions? Scar tissue is when there's some sort of a cut or an incision or a break within an area, the skin and the soft tissue, and the body sends connective tissue to repair it and give you some stability. Adhesions are what happen within the body, and it can happen most anywhere, but where it happens most often is in the abdominal cavity. And what happens is you have dysfunction in one of the structures, whether it's organ, fascia, or some kind of bones, for example. And with the dysfunction in that area, what it does is it bleeds into other structures next to it, no matter what the other structures are. So what they end up doing is they end up becoming adhesed together. The more adhesions you have, the more diminishment of function you have. And what ends up happening is, if these two structures adhere together, and then I get less function, then they adhere to the structures on other sides of them, and you end up getting many, many adhesions. And this especially happens in the abdominal cavities between the lobes of the small intestine, between the large intestine and small intestine. You can have an ovary stuck to your large intestine. These are adhesions. So scar tissue is what the body does when it has some sort of a cut or an incision, and it gets signaled to then start sending tissue to stabilize the area. So this is just an example, just a quick example of, say we have muscle, okay, and all the fibers in your muscle are going the same direction. Then what happens is say I have to have a surgery. So they're cutting through somewhere here, they're going to cut through, and you then are going to get sewed back up, glued back up, stapled back up right in here. Then what happens is when the body is signaled for this incision, what it does is it starts to send connective tissue to repair it, but it doesn't send it in this lovely ordered original sort of format. What it does is it sends it just so that it actually can solidify or make it really stable, the area. What happens when the tissues come in this way is that you get less mobility and you have more locking in here. So the beautiful stretch that that happens through here begins to not happen here. The other thing that happens here is when the body starts to send the connective tissue, the body doesn't stop sending connective tissue for quite some time. So although the incision may have only been this big, now what's happening is fibers further and further out are actually adhesing together. You get less function, you get less blood flow. What can a practitioner do is come in and start to break up all this tissue, both with adhesions or with scar tissue. If you begin to break it up, it starts to stop the development of more scar tissue, more adhesions, and it also allows the fibers to somewhat get back into an order there. So giving you more freedom, more blood flow, and less pain. And that's just a little bit about scar tissue and adhesions that I hope will help you in your practice. Thanks.